Hello, my name is Jared Reese. I'm a PA with Florida Vein Care Specialists. Today, I would like to discuss restless leg syndrome and the correlation between restless leg syndrome and vein disease. Many physicians consider restless leg syndrome to be a sleep, psychiatric, or neurologic disorder. However, in many patients, vein disease is the cause of restless leg syndrome. Restless leg syndrome occurs in 7 to 10% of the population. It occurs in both men and women, but is more common in women. It may occur at any age, but symptoms seem to worsen as age increases. What are the typical symptoms of restless leg syndrome? Symptoms include uncomfortable sensations of the legs that can be anything from aching, to throbbing, to itching, or even pins and needles. All of these uncomfortable symptoms lead to an irresistible urge to move the legs. The discomfort is relieved when the legs are set into motion. The symptoms of restless leg syndrome often occur in the late afternoon or at night. The symptoms can interfere with the ability to sleep, leading to fatigue during the day. If left untreated, restless leg syndrome can lead to anxiety or depression. In many cases, the cause of restless leg syndrome is unknown. When evaluating the patient, we look closely to determine if there is a secondary cause. By far, the most common secondary cause is vein disease. This is diagnosed with a simple 10-minute in-office venous ultrasound. In addition, this can be treated with an in-office laser procedure. This is non-invasive with minimal recovery. There are medications that are used to treat restless leg syndrome. Unfortunately, most of these have significant side effects. They often only treat symptoms instead of fixing the underlying problem.
So how can correcting a patient's vein disease cure restless leg syndrome? The correlation is not well understood, but there have been multiple studies linking vein disease with restless leg syndrome. These studies demonstrate that people with restless leg syndrome are much more likely to have abnormal venous ultrasounds than are their age-matched peers. When laser vein treatment began around 2008, it was discovered that these treatments cured both vein disease and restless leg syndrome. This was confirmed in a study published by Hayes in 2008, in which patients with restless leg syndrome and vein disease underwent laser vein treatment. The average symptom severity score went from 26.5 to 5.5, and 84% had relief of some or all of their restless leg symptoms. At Florida Vein Care Specialists, we feel strongly that every patient suffering from restless leg syndrome should undergo a venous ultrasound to rule out vein disease as a cause of their restless leg syndrome. If patients are found to have venous reflux, a simple 15-minute in-office laser procedure can completely alleviate the symptoms of restless leg syndrome. This minimally invasive procedure can dramatically improve quality of life, especially for people that have been suffering for many years with these debilitating symptoms. If you are suffering from restless leg syndrome, call the experts at Florida Vein Care Specialists.